Now, injuries to the knee is probably the most common sporting injury that we find here in the clinic in Isa. People doing lots of twisting, turning, jumping, obviously get lots of knee injuries, okay? So there's different structures in here. I'll just sort of orientate you to the anatomy of the knee. We've got your kneecap, which is known as your patella, which sits at the front here, and that sits inside two tendons. This one's your quads tendon, this one's your patella tendon. Around the back of the knee here, we've got your meniscus, your cartilage meniscus rings, which sit here, and there's two of those, which sit on the medial and lateral side. And then we've got your ACL and your PCL, which are ligaments on the inside. And then we've got two other ligaments, your MCL and your LCL, which sit around the outside here, and they provide lateral stability to the knee. Okay. Now, one of the most common injuries that we generally find is injuries to these ligaments on the outside. So by playing sport, twisting, falling over, we get lots of sprains to these ligaments. So this one here is called your MCL, as I explained before, your medial collateral ligament, and this one here is called your LCL, which is your lateral collateral ligament. Okay. Now, any sort of force coming from the outside will generally sort of cause the knee to do this. And you'll notice that you stretch this ligament here, which is your MCL. Okay, stretching this MCL, you can usually put a bit of a tear in it, and it's a ligament. It's a soft tissue ligament structure, and by tearing this, you basically will lose the structural integrity to the joint and the stability to the joint. It can be very painful. We rate our tears between 1 and 3. So a grade 1 tear is a small tear, 2 is slightly more, between 15 and 90% of fibres, and then a grade 3 is a full thickness tear. If you're getting pain on the inside of the knee, it's usually to do with that ligament or the meniscus, all right, which is the cartilage ring. And therefore, if you think that you're struggling with ligament or meniscus pain on the inside of the knee, pop into the clinic. There's lots of things that we can do to sort of speed up the process. Usual healing times are around sort of 4 to 6 weeks, but depending on the severity, it can be a lot quicker or unfortunately a lot longer as well. So if you think you're struggling with any sort of ligament pain there around the inside, then give us a call and we can have an assessment, come up with a diagnosis as to exactly what's going wrong, and then we'll get you started on some treatment.